Welcome to another edition of the Columbus Community Spotlight, brought to you by Bank of the Valley. Dr. Joan Keat joining me today. Doctor, how are you doing?
Hi, fine, thank you. How are you?
Good. We've had the chance to talk before on Meet the Docs, but now we're on the Spotlight. Tell me what you guys have going on.
Well, April is Oral Head and Neck Cancer Awareness Month.
Okay.
A lot of people don't know that, but for that we're doing some education, let people know what the risk factors are and how to avoid head and neck cancers and cancers in the mouth. And we're going to have a free cancer screening, so anyone is welcome to come. It's going to be just one day this month, April 25th at 5 o'clock, and it's jointly sponsored by Columbus Cancer Care Foundation and Columbus Otolaryngology Clinic.
Is this an event that's widely attended, or is this something you're really hoping to get the word out and hoping you do have a big draw?
We're hoping to get the word out. We've done this for about 5 years, and we vary. We'll have a handful of people come. Some years we've had 30 or 40 people come. But we're trying to reach a larger population now, especially people who smoke or drink any alcohol.
Okay.
That is a risk factor for cancers in the mouth and throat.
Yeah.
And there's a growing population of people who don't smoke or drink but have been exposed to HPV or human papillomavirus, which gets a lot of press because it can cause cervical cancer, but it can cause lots of other cancers, including in the mouth and throat. So even people who don't have known risk factors should get screened once a year.
If someone's nervous about coming to something like this, obviously, if you find out you do have cancer, it's a big decision to hear about, but it's something you need to know. What would you do to calm people or maybe encourage people to come if they're nervous?
Well, if you're nervous, you need to know that the exam takes about 2 minutes.
Okay.
It does not hurt. We don't do anything that's very invasive. Basically, it involves checking the neck for lymph nodes, checking in the mouth and back of the throat area, but we don't stick anything down your throat or nose. So 2 minutes, absolutely no pain. If there's any questions, then we would set someone up for a biopsy.
Okay.
But the thing to know is when we find cancers in the mouth and throat that are early, they're almost all curable, over 90% curable. Whereas when we find them later, we have much lower cure rate.
That might be the most comforting thing about it, to know that it's very curable if you find it early.
Right.
So do people need to register, or how do they find out, or what do they need to do to get in for this?
Well, walk-ins are welcome, but we do prefer to have people call because it will help our schedule flow. So you can call my office, which is at Columbus Cancer Care Foundation at 562-8666.
Okay.
Or you can come by. It's going to be held at Columbus Otolaryngology Clinic, which is in the medical office building next to Columbus Community Hospital.
Yeah, you guys are right on that stretch of just new buildings and everything on, but
Little
great.
medical strip, yeah.
Yeah, and then you guys have a beautiful office too. It's very beautiful. So people haven't got a chance to. That might be a reason enough to go check it out, is to see the office. It's very cool. So, what kind of signs or symptoms might someone have, and maybe if they have some of these, they should come see you guys?
Well, in the earliest stages, someone might have a non-healing sore in their mouth. It can look like a white patch, or it can be red, or it can look like a little ulcer. You can certainly get little ulcers in your mouth like cold sores for other reasons, but if it's not healing after about 2 weeks, the person should see their doctor. Sometimes people will present with problems swallowing, either feeling a lump when you swallow, or having pain with swallowing, or feeling like food's going down the wrong pipe. And then another common presentation is a lump in the neck, which could represent a lymph node.
Oh, okay. And these are very general,
general,
issues,
yes.
but it's something that, worth getting checked out. It doesn't mean you have cancer, but it's worth getting checked out if you have these symptoms. So
something you should go see your primary care doctor or your dentist, or come down and get your free screening.
Perfect. And again, date and time for when you guys have it going on?
It's April 25th. At 5 o'clock is when we start, and we will stay there until everyone is seen.
Perfect. And then if they want to call you, how do they reach you guys?
562-8666.
Perfect. All right, Dr. Keat, thank you so much.
Thank you.
All right, and thank you guys, too, for joining us for another edition of the Columbus Community Spotlight, brought to you by Bank of the Valley. We'll see you next time.